All right, this is the GI and urological emergency. Um, so, class, here's your EMS education standard. GI bleeding, anatomy. We'll go back over that. Management of shock associated with this. Acute chronic GI hemorrhage, peritonitis, ulcerative diseases, and then some blood pressure problems as far as your renal system, end-stage renal disease, catheter management, kidney stones. We will not insert catheters. We'll just manage those that may become infected or complicated. So, I'll go over some stuff with that. So, the only thing's common complaint. There's a lot going on, in the abdominal area. There's gonna be many different things that's going on. So, a lot of times you will not want to know the exact cause. We can look for some signs, determine some symptoms, maybe what's going on. But a lot of this is going to be needed to take care of at the hospital. Management of pain, probably some signs and symptoms that we're seeing. So, there's not a whole lot we can do here. Life threatening as far as blood pressure problems, end-stage renal disease, your dialysis patients and their shunts to take care of those. So, all right, there's solid organs, including liver, spleen, and pancreas, and there's hollow organs. Okay, so a solid organ that's something filled up with something, some stuff that can cause shock and bleeding. So that's a life-threatening issue. There's the different areas, your different quadrants in the middle. So the main function is to absorb the products of digestion and fuel the cells within the body. Assists the mouth, salivary glands, pharynx, esophagus, stomach, intestines, liver, gallbladder, pancreas, and rectum, and anus. All right. During the digestion, the process takes 8 to 72 hours. The salivary gland secretes saliva to help lubricate the food. Once food is swallowed, it moves through the esophagus, the veins around the esophagus, in combination with other forms of portal vein. Okay. So once you swallow, the food moves through the esophagus, it's pushed along using the rhythmic contractions called peristaltitis. The cardiac sphincter is designed to prevent food from backing up into the esophagus. Okay, the portal veins transport venous blood from the GI tract directly to the liver and process the nutrients. So if the blood flow through the liver shows, blood may back up throughout the entire GI system. The stomach secretes hydrochloric acid to break down the food. It absorbs the water, alcohol, caffeine, and all medications that you have. The liver secretes the bile. It filters toxic substances. It creates glucose storage. It produces substances for blood clotting and immune function. And the gallbladder acts as a reservoir for bile. All right, first part of the small intestine is the duodenum. It absorbs resources for use for other cells by the body. This is where the pancreas, liver, and gallbladder connect to digest in the digestive system. So pancreas secretes the enzyme amylase, and pancreas also produces the bicarbonate and insulin. All right, the small intestine is where 90% of absorption occurs. It produces the enzymes that turn chyme into substance called that can be absorbed by the capillaries of the small intestine. The jejunum, it comprises of a large amount of the surface area of the small intestine and does much of the work. The ileum is the final part of the small intestine. It absorbs nutrients that were not absorbed earlier. It absorbs bile acids and also absorbs vitamin B12. All right, the large intestine, as far as the colon, is substance not broken down and enter the colon or waste products or feces. Primary role is to complete the reabsorption of water and solidify the digestive materials. So it is the site of bacterial digestion. All right, it's attached to the last portion of the colon, and it is the rectum. All right, the spleen does not right now have a digestive system function as part of the lymphatic system, and it assists in the filtration of blood. Okay. Here's your genital system as far as the male and the female, and we'll have a lot more of this later. And then the urinary system consists of the kidneys, the urinary bladder, the ureters, and the urethra. Right. Two main functions to regulate electrolytes and water content and acids in the blood. So the kidneys filter about 200 liters of blood per day. They produce the hormone that regenerate new red blood cells. So they play a major role in homeostasis. And the nephron is the functional unit of the kidney. They're found in the cortex, and they also eliminate metabolic waste products from the blood. All right, when kidneys fail, the patient loses the ability to excrete urea from the body, which is the leading cause of the condition called uremia. Once the urine enters the collecting ducts, it passes through the minor calyx into the major calyx, and then it is into the renal pancreas itself. The urine moves through the ureter and is stored by the urinary bladder. The brain exerts control over the urge to void. Then urine is expelled from the bladder through the urethra. So, acute abdomen is a sudden onset of abdominal pain, and sometimes this indicates peritonitis, which is often caused by an infection penetrating the abdominal wound, or a penetrating abdominal wound, a blunt injury severe enough to damage abdominal organs. Okay, your major signs could be your tenderness and distension. Parietal peritoneum lines the um, abdominal cavity. It consists of two membranes. Okay, so they are supplied by the same nerves from the spinal cord that supply the skin overlying the abdomen. So this can perceive the sensations of pain, touch, pressure, heat, and cold. The visceral peritoneum covers the surfaces of each of the organs in the abdominal cavity. It's stabilized by the autonomic nervous system, which is stimulated when distensions or contraction of the hollow organs activates the stretch receptors. This sensation is usually interrupted as a colic, or interpreted as colic, and a severe intermittent cramping pain. All right, when these receptors are at the affected organs are stimulated, they send impulses along the nerves to the brain where it is interpreted as pain. So visceral pain is the type of pain most commonly associated with urological problems. Okay. Um, right, referred pain is other painful sensations that occur because of an irritated visceral peritoneum. So it may be perceived at a distant point on the surface of the body, such as the back or the shoulder. And this is results because of the connections between the body's two separate nervous systems. Peritonitis typically causes ileus, which is vomiting. It's associated with loss of fluids into the abdominal cavity and potentially causing hypovolemic shock. So the patient may have normal vital signs or signs of shock, and a fever may be present. Okay. Most of the time that fever is present in diverticulitis or cholecystitis. Patients with appendicitis may have a normal temperature until an appendix rupture and an abscess starts to form. Okay. A lot of your urology system problems, they can range from UTI to kidney injury, and a lot of time we are just there to help support the signs and symptoms that we can. Right. There's all the locations of the pain and what's the associated condition with it. A lot of things can be a cause of an acute abdomen. Um, I mean, anything that's going on inside of the abdominal area that's not normal, is going to cause some type of pain. So, GI hemorrhages can be acute or chronic. A lot of your chronic alcoholisms or alcoholics may have GI bleeding, upper and lower. So, esophagitis, inflammation of esophagus, affects from our irritation and swelling. Not a whole lot there. We're just going to treat signs and symptoms. So, Your GI bleeding, find out what kind of feces or what color blood they see, dark tarry stools, bright red, different things like that. GERD is acid reflux, buildup of heartburn sensation in the esophagus itself. A lot of this is just due to stress. Eating fatty foods, drinking alcohol, different things like that could cause the GERD. Um, However, with this, please be mindful that GERD could be a sign of a cardiovascular event, so a 12 lead would not be a bad idea. Like ulcers, abrasions of the stomach, small intestines. So, usually caused by chronic usage of anti-inflammatory drugs, alcohol, smoking. Right. More frequent in older age group, burning, gnawing, upper abdominal pain, blood, sternum. So nausea, vomiting, spitting up blood, vomiting. So, mallory wise tear is tearing the junction between the esophagus and the stomach. So it usually causes of alcoholics, eating disorders, and violent coughing and vomiting are your principal causes. So we're just going to take signs and symptoms, try to help them spit up the blood. Don't let them swallow it. Forehead syndrome. So esophagus tears longitudinally, and the tail travels entirely through the wall of the esophagus. Sent after a large meal that includes alcohol consumption. Esophageal varices occurs when the amount of pressure within the blood vessels surrounding the esophagus increases. So when the blood is blocked up in the portal vessels, the vessels dilate, causing the capillary network of the esophagus to begin leaking. So if the pressure continues to build, the vessel walls may fail, causing massive upward GI bleeding and hematemesis. So in industrialized countries, alcohol is the main cause. In developing countries, viral hepatitis is the main cause. So several different signs and symptoms here. Hemorrhoids, swelling inflammation of the blood vessels surrounding the rectum. So usually a strain or a pregnancy can cause these. Gallbladders, gallstones, digestive juices and waste from the liver, pain. Sometimes the blockage will pass when it does an inflammation of it results. Gallstones, same thing, 30 minutes after a fatty meal, usually at night. However, that gallbladder can rupture, and it's usually pain that is constant in the right upper mid abdominal region, and it has referred pain to the right upper back. Pancreatitis, usually obstructed gallstone, alcohol use, severe pain in the right upper left or right phalanges, often radiating to the back. All right, appendicitis, that sharp pain, center umbilical area. Nausea, vomiting, lack of appetite for food, fever, chills, some rebound tenderness also. Gastronitis, bacterial organisms usually cause this from food or water. Diarrhea, foul odor, odorless, abdominal cramping, anorexia, and dehydration. And sometimes it's just, it can be related to upset stomachs also. Diverticulitis, 1900s, when the types of foods people ate changed. So the amount of fiber consumed decreases, consistency of stools become more solid, requiring more intestinal contraction, increasing pressure in the colon. It bulges in the colonic walls. Bulges become diverticular, and fecal matter may be called. So there's your signs and symptoms on that. Ulcerative colitis, inflammation of the colon, and it's unclear why. And here's your signs and symptoms for that. Irritable bowel syndrome, patients having normal pain changes in the bowel habits. So hypersensitivity of bowel pain receptors and hyper-responsiveness of the smooth muscles in the bowel. Sometimes psychiatric disorders are in connection with IBS. Crohn's disease, similar to ulcerative colitis, but can involve the entire GI tract from the mouth to the anus. No definitive cause. Most of your patients are between 15 and 35 years of age. African Americans seem to be affected more. All right. Conditions range in the urinary tract infections, tract infections to acute kidney injuries. They usually were just there for supportive care. Like fever, low grade fever, changes in the urine color, possibly some abscesses being, noticed. And really, this can lead to sepsis. So be very mindful of these patients. So they can have blood tinged urine, different things like that. So, all right. Kidney stones arise with the excesses in soluble salts or uric acid crystallizes in the urine. And the kidneys can't get rid of it. So it is more frequent in men. Hereditary also. A lot of this right or left flank pain radiating around to the umbilical area, just blood out, and difficult urination, burning while urinating. So sometimes there is a change in voiding. Also, you need to be mindful of that because it can cause a backup of urine into the urinary bladder, which causes edema, which could cause CHF because of the pressure build up. Okay, so be mindful of that. CKD progresses when it's irreversible kidney damage, so and it can be systemic also. And there's some signs and symptoms of all that. End-stage renal disease, kidneys have lost most of their ability to function. Toxic waste materials build up in the blood and fatal unless treated by dialysis or renal transplantation. There's some signs and symptoms of that too. All right, this talks about the uremic frost may be present around the face and the skin. Be mindful of that. That's basically the body's way of getting rid of the urine. So make sure you're wearing PPE. Gynecological problems. PID, inflammation of the fallopian tubes. Ectopic pregnancies. Epididymitis or ocordalis is a complication of UTIs. Infection causes inflammation of the epididymis along the posterior border of the testes. So leading to pain and swelling in the scrotum when they become enlarged. Hyperism is a painful temporary persistent ingression that does not resolve itself, such as blunt force trauma, spinal cord trauma, use of cocaine, different things like that. So try to maintain the patient's privacy as much as possible. BPH, age-related non-malignant enlargement of the prostate gland. So starting urine flow, slow weak urine flow, and complete emptying of the bladder, and increase urination at night. Testicular masses, so may or may not see these. So testicular torsion is twitching of the testicles and the spermatic cord. It's very great pain in that area, and a lot of times these patients will tell you that's what they know they got. And basically, the vessels have to be twisted back around. Older people with it's the wide aorta resulting in an aneurysm, and this is that tearing stomach pain, massive injury that could occur in the peritoneal irritation. All right, a hernia, protrusion of organ or tissue in, through a hole into the body cavity, does not always produce a mass or a lump. A lot of these patients can move these hernias in and out, so be mindful of that. Surgical reduction of these is what has to happen here. All right, make sure it's safe. Get a good sample of PQRST. Um, GI symptoms suspect a biological or chemical agent, possibly, especially if there's more than one. There's your common signs and symptoms. Talked about. May exhibit many problem symptoms as a patient with other abdominal problems. So make sure you get a good detailed sample and a good detailed PQRST kind of narrow these down. So, all right, check for your vital signs. Something needs to be changed. Be mindful and get ready to change it. If they are evaluating shots showing shock-like symptoms, please treat them for that. Also maintain their temperature. Orthostatic vital signs don't hurt with abdominal pain. Just it can tell you if there might be a bleed or something going on. For some reason, the patient's laying supine. Then they stand up. The body has to work more, and the body goes into a little bit of distress, and the blood pressure drops and the heart rate increases. This could be a sign of shock. So you may want to start treating them for the shock. Looking inside the toilet, the patient says they had a BM and see blood or they've thrown up in the toilet just to see if you see any blood around it also. All right, make sure these patients have specialized treatment. Make sure they've got internal medicine or GI medicine ready and available when you get there. OBGYN also. OPTQRST, sample, chest pain, 12 leads don't hurt, checking for your trauma, and then just going back over everything. Don't do the first palpation in the quadrant that's hurting. Wait till last. A lot of these patients sometimes won't even let you press in on those. So palpate, inspect, check for rigidity. Some people percuss to see if it's solid or hollow. So it's kind of up to you. Scale 1 to 10, which quadrant it is. If you use the 4 9-quadrant system, then reassess everything. Check your blood pressures. If they're really in bad pain and you might need something for the vomiting, you might call for a paramedic on those too. So I may need surgery. Maybe acute, not acute. It's just going to kind of depend on what your signs and symptoms show. IVX is if they are hypotensive, I'll go ahead and put 2, or hypovolemic shock, go ahead and put 2 IVs in. NPO is very important because they may be going into for a surgery. Kidney stones, if you have the NSAID available to give for that, that's great. Just make sure it's in your formulary at the advanced EMT level. All right. A lot of this is just supportive care and transport, checking for signs and symptoms of shock, and treating those. Your fistulas with your end-stage renal patients, they're there to pretty much for dialysis. However, sometimes these things do not clot off very easily. So, these fistulas are in there to connect arteries and veins to veins in a large area. So be mindful of those. Sometimes they bleed and it takes a lot of pressure to hold that, stop that bleeding. So not only are you having to treat a hemorrhage there, but you're having to treat your patient's hypotension. But be mindful of that too, because these patients cannot get rid of fluid like we can normally. So it's a tip for a tat situation here. All right. Those are your adverse complications from renal dialysis. A lot of those patients are metabolically out of whack most of the time. Dialysis is something that takes um, a lot of their go-getness, being normal is taken out of them. So they may be tired a lot of times after dialysis, may not feel like doing what they're usually used to doing. So, and sometimes you maybe just need to replace those electrolytes. So, yeah, embolism is possible. All right, that's the end of that chapter.